Everyone, welcome on a little rainy day in Chicago, a rainy evening. We really appreciate you joining us this evening on our Dinner with the Doctor series focusing on fertility and celiac disease. I am so excited to welcome, we have some fantastic colleagues with us tonight who will share knowledge, and I want to go over a few housekeeping things before I do introductions. At the bottom of your screens, you will see a Q&A function. If you want to put your questions at the bottom of that screen and or chat, we will absolutely get to those after a short talk. And in addition, I know some of you pre-submitted questions, and we will absolutely incorporate those into our discussion this evening. And I do want to let everyone know this program is being recorded. So if for any reason you join late or get dropped off, just please know we will be sharing the recording and have it as reference for you for after this evening's program. So I'm Rachel Lieberman. I'm a director here at the Celiac Disease Center, and I'm so happy to have all of you join us this evening. I get excited and I kind of jump all over the place, but I am so happy to welcome Dr. Sana Salih, who is with us. She is a double board certified doctor in gynecology and obstetrics and reproductive and endocrinology and infertility. And she is obviously highly credentialed high complexity laboratory director here at University of Chicago. Dr. Salih provides comprehensive care to patients struggling with infertility issues and recurrent pregnancy loss. So we are so happy to have her give some insight into this very important topic tonight. I'm also joined by Dr. Carol Semrad, who is one of our adult gastroenterologists here at the University of Chicago. She is a wonderful partner with us here at the Celiac Disease Center. And not only does she see patients in celiac disease, but also specializes in small bowel diseases and nutrition. And then we also have Dr. Ritu Verma, who is our medical director and chief of pediatric gastroenterology here at Comer Children's Hospital, amongst many other titles. But we are so happy to have Dr. Verma with us as well, and who is a wonderful partner in helping us bring education forward. And Lindsay Yakel, who you all get a lot of communication from, who is our educational director here at the Celiac Center. And we are so happy to have her. And I do believe later this evening, we will have Lori Wellstead, one of our amazing dietitians, adult dietitians, who will be with us during the Q&A portion of this evening's program. So I want to welcome this team, and I would love to turn this over to Dr. Salih, who will begin by sharing a short talk with us this evening.
Hello, everybody. It's really an honor and a pleasure to join your forum today, and I'm very excited and look forward to a very interactive section. I will start by giving a small introduction about the relation between celiac disease and infertility, and also other reproductive health issues. So in these few slides, I'm going to talk about the relation between celiac disease and reproductive health disorders, but I'm also going to explain how we investigate patients with celiac disease for infertility and how do we treat them. So as you all know, celiac disease is a chronic inflammatory condition that affects the small intestine and causes malnutrition in response to gluten-containing diet. And it's estimated about 1% of the population may have celiac disease. So there have been many studies in the past that found that women with undiagnosed celiac disease may have issues with infertility. And even if they get pregnant, they may have issues with keeping the pregnancy. So they will have recurrent pregnancy loss and some other reproductive health. But this topic has been very controversial, and the research has been kind of conflicting to some extent. In particular, there is one study that came from Nottingham, from UK, and showed that there is no relation between celiac disease and infertility. The relation only exists for women who are aged 25 to 29. But then a very recent study from Cleveland Clinic in 2023 last year is a huge national cohort analysis that had given us a very interesting finding, which I would really like to share with you today. So going back from the beginning, what is infertility? Infertility is the failure of a woman to conceive within 1 year or more of regular unprotected coitus or with exposure to sperm. And this year is arbitrary kind of timeline because we know that you don't have to wait for a whole year. If a woman is older than 35, it's centrally recommended that they seek fertility treatment 6 months after trying. And women older than 40, they should really seek help within 3 months after trying. Just because the window for fertility and the egg number and egg quality drops with advancing age. But also, if a woman have any other problem like irregular period, polycystic ovary syndrome, endometriosis, history of infection, it doesn't make any sense for them to just wait. I think it's reasonable for women to get tested and make sure everything is okay, even before they start. The same thing goes for men as well. If somebody have varicose vein or they have like undescended testicles or hernia surgery, then it also makes sense that they get tested. So while I'm preparing this topic, I was actually really surprised because we always said infertility is about 15% of people will have infertility. However, reviewing the CDC data from May, like last month, I found that about 20% of reproductive age women will have infertility. So 20% is a lot of people. Not only that, 25% of women will have problem giving a birth to a live birth, meaning in addition to infertility, there is an extra 1% of people will have things like recurrent pregnancy loss and problem with the pregnancy leading to failure to have a live birth. For men, is estimated about 10% of men may have infertility. So to understand the relation between celiac disease and infertility, I think we have to go into what causes infertility. So infertility can be to male factor in about 40% of the cases, or can be due to female factor in about 60% of the cases. Now, if you look into the female factor, there is many categories. And one of the biggest category is unexplained infertility. It says 28%, but honestly, up to 1/3 of couples or individuals seeking fertility may have unexplained. And I'm going to get into what that means. But this is a category where we think some of those patients may actually have celiac disease that we did not diagnose, and now we're calling them unexplained. Now, other categories in women will include things like ovulatory dysfunction. So if the ovary is not working, that will cause infertility. Endometriosis and tubal damage. So you'll be surprised with the studies that I'm going to share with you that celiac disease can actually cause ovulatory dysfunction and is associated with endometriosis. So it seems the connection between infertility and celiac disease is just not just the autoimmune unexplained category. There's an other thing that can actually contribute to infertility as well in patients with celiac disease. So when we look into what causes infertility, I mean, obviously it's very basic. Usually we say we need the sperm and we need the egg. And where do they meet? Usually they meet in a fallopian tube. This is where they meet, and they actually fertilize in the fallopian tube, and they make a small little embryo that grow for a week or so in the fallopian tube, and then that embryo will go and implant in the uterus. So these are the components for anybody to become pregnant, right? So this is what we check when we wanted to check somebody. We check the sperm, we check the egg, we check the tube, we check the uterus. And when everything checks out and there is no problem, then this is when we call it unexplained infertility. And again, this is where some of those people may have celiac disease that we're missing, and we're calling them unexplained. So as I mentioned, many studies have shown that celiac disease is associated with infertility, recurrent pregnancy loss, and other health problems, right? One study showed that women with unexplained infertility may have about 5 to 6 times increased odds of having celiac disease. So although it's not a standard of care to investigate people with recurrent pregnancy loss and unexplained infertility for celiac disease, but it certainly does make sense if anybody has some symptoms in addition to infertility and celiac disease. As a matter of fact, this may be the first time that somebody is recognizing they have celiac disease when they come for fertility testing. Now, the recent study that I mentioned is an amazing study. It's really huge in magnitude. It was an abstract presented at the American College of Gastroenterology last year, October 2023. And they compared 10,000 women with celiac disease compared to 25 million women without celiac disease. So I think this is the largest database we ever seen in this field. And that study showed that celiac disease is associated with a lot of reproductive health issues, right? Very interesting, they found that there is patient with celiac disease have 6 times greater chance of primary ovarian failure. Why would the ovary fail? We know that ovarian failure can be due to autoimmune issues as well. And autoimmune disease tend to cluster together. So it doesn't make sense if somebody have autoimmune celiac disease, they may also have ovarian failure, which can cause infertility. Interestingly, on the flip of the coin, they found that celiac disease can be associated with polycystic ovary syndrome, where it's too many eggs, right? It's also associated with other things. So some of the studies showed that patients with celiac disease may have a problem with irregular periods, and they may have a later age of menarche, they may have early menopause or amenorrhea. And they could be a lot of factors, but I think malnutrition is known to be associated with menstrual irregularity. When somebody is malnourished, whether it's been celiac, whether it's been anorexia nervosa, whatever it is, they tend to have menstrual irregularity. And of course, those can cause infertility as well, right? So that study I referred to also showed that celiac disease have 6 times increased risk of ovarian dysfunction. There is 3 times higher risk of polycystic ovary syndrome in women with celiac disease, and there is 2 times higher risk of developing endometriosis with women with celiac disease. And again, I think it's all have to do with these autoimmune antibodies, because all of those diseases tend to kind of cluster together. And studies also showed that the risk of recurrent pregnancy loss is increased, but not only that. Even when people go beyond the first trimester, they could have preterm delivery. They could deliver preterm. They could have small babies as well, which is growth restriction. And again, that all had to do with the malnutrition, deficiency of those vitamins, all these antibodies that can affect the placenta and affect the pregnancy. Interestingly, some studies show that there increased risk of cesarean delivery in patients with celiac disease, right? And interestingly, some studies show that there is decreased duration of breastfeeding with celiac disease. And I'm not quite sure, but I was surprised to know that a postpartum state can actually exacerbate celiac disease. And maybe this is why these women just get tired and exhausted and kind of move on. Also, studies show that celiac disease is associated with other endocrine disorders, right? And that's not surprising. Why? Because most of those endocrine disorders are also autoantibody disorders, right? For example, type 1 diabetes mostly is due to antibodies. And then so is this autoimmune thyroid disease and also like liver disease, right? Cirrhosis. And again, if you think about it, somebody with thyroid disease, diabetes, this also will affect fertility as well. So it's kind of a little circle, right? Kind of affect, celiac disease affect a lot of things, and these things come back and affect fertility. And I think this is how we can tie in things together, right? Interestingly, I just mentioned, we mentioned that celiac disease can affect pregnancy and fertility. Guess what? Pregnancy and postpartum status can also affect celiac disease. So there's some theories saying that, so in pregnancy, what's different? There's a lot of hormones, and there's also some fetal antigen. Fetal antigen, the fetus is 50% paternal antigen and 50% maternal. So some of those fetal antigen can actually affect the pregnancy. So there have been some studies showing that there is increased incidence of celiac disease showing up in the 2nd and 3rd trimester, or even in the postpartum period. And again, just maybe due to exposure to fetal antigen and due to exposure to hormones during pregnancy, right? So what about men? Well, men are also involved with celiac disease. So 1% of men with infertility may have celiac disease. And when I reviewed the literature, there is a couple of things. Celiac disease tend to affect semen analysis. So those people will have abnormal sperm in terms of motility of the sperm and morphology or no shape of the sperm. But interestingly, celiac disease also affects the hormone in men. So they have some sort of androgen resistance. What does that mean? So usually the brain, the hormone called luteinizing hormone comes from the brain and it stimulates the testosterone in the testicles. And when the testosterone is high, it will inhibit that luteinizing hormone. So it kind of created some hemostasis and some normal testosterone. But in this study, it looks like the luteinizing hormone was not negatively inhibited. So it was always active. So there was very high LH and also very high testosterone. So these issues were actually rescued and were normal when these men were following dietary modification with gluten-free diet. So this is why that connection was established as well, right? So now just one slide to talk about how could celiac disease cause all these things. As far as pregnancy is concerned, there had been a lot of lab studies and even studies in humans showing that these antibodies that comes, the transglutaminase antibodies that comes from celiac disease can actually attach to the certain cells in the placenta called sensitive trophoblasts. And these are the cells that make the villi that lead to exchange of blood and nutrition and oxygen between the mother and the baby, right? So when they affect these cells, then obviously they're affecting the pregnancy. So they can prevent implantation. They can also prevent growth of a healthy baby. So I think that's kind of makes sense. But of course, we talked about nutritional deficiency. So fertility and pregnancy, both of them need a lot of things. You have to have normal calcium, vitamin D. You have to have all these elements like zinc, selenium, folic acid, and all these things. So any deficiency in these things, these elements, and can affect pregnancy and fertility as well. More importantly, a low BMI due to malabsorption and malnutrition can cause a ton of problem. In addition to menstrual irregularity, can cause anemia, depression, bone disease, certainly abnormal weight, being extremes, being obesity or being underweight, both of them does contribute to infertility and pregnancy complication. And then lastly, we did mention that celiac disease seems to be associated with a lot of other things, right? All these endocrine issues, all these polycystic ovary syndrome, endometriosis, this and that. And of course, all these things can affect infertility as well, right? So, how to diagnose celiac disease, I'm going to leave that to my colleague if they want to comment at the end. But once you diagnose with celiac disease, I think it makes sense if you are a reproductive age person and you individual and you want to conceive or build a family, it does make sense kind of to check in with your gynecologist or your fertility specialist to see how can we help you out, right? So when I see somebody in the clinic with celiac disease that's trying to, conceive or whatever, what do I do? Generally speaking, we check few things. We check the sperm for men, we check the ovaries, the uterus, and the tube for women, and we do some blood tests for both, right? So just quickly to go through this, when a man comes to the clinic, we do something called a semen analysis, produce a sample of the sperm, and then we run like 15 tests on this sample. But there's only very few things that really matters. We see what the volume is, see how many swimmers are there, make sure they're moving, make sure their shape is normal. So that is the semen analysis. Now remember, 40% of individuals or couples with infertility may have a male factor. So that very simple test will help us kind of figure out if that's a problem or not. For the women, we do a couple of things. We look at the ovary, and as you can see, this is what the ovary look like. These black spots are called follicles. So they are a small little sac with eggs. So we can actually count how many eggs a woman have in any particular month. Usually women have of course you have a ton of eggs in your reserve that we don't really see, but we just count the growing eggs, the ones that are growing every month. So normally women will grow about 10 to 20 follicles with 10 to 20 eggs, and one of them will ovulate, right? Some women have polycystic ovary syndrome, they grow a ton of egg. Some women have ovarian failure, they have no eggs, right? So when I see a woman, it doesn't really, like I can't look at anybody looking at their shape, their color, their age, even the diagnosis, you can't really tell. You just have to do the test to see what the ovarian reserve is. And we also check something called AMH or anti-Mullerian hormone that can help us figure out the ovarian reserve. We can check the tubes, and this is what the tube look like. This is an X-ray, but a lot of time nowadays, we really don't do X-rays. We just do the ultrasound to help us with the ovary, but also check the lining of the uterus and the tube at the same time, right? So once we do this testing, which is very simple, and it only takes really 1 month by the most, right? Once we do this testing, then we'll be able to figure out what's causing the problem. Of course, celiac disease, a lot of patients are going to have unexplained, so everything is going to check normal, right? But sometimes they may have something else that we have to find out. And the treatment option in general, just to make it very simple, we often do some sort of ovulation induction to make sure that we woman kind of grow an egg properly. And then a couple of things that we do in the clinic, we do something called insemination, where we put the sperm in, very, very similar to time, sex, or natural conception. Or we can do something more advanced, which is in vitro fertilization or test tube babies. So when we do insemination, we give the woman medicine to make her grow only 1 or 2 eggs. And this is what that follicle with an egg inside look like on ultrasound. Only 1 or 2. Why? Because we don't want a lot of babies. We just want 1 at a time, right? So that's what we do. And then after that, obviously, we make sure that egg come out to ovulate. We give them medicine to do that. And then we put the sperm in. And we put the sperm in, we putting ton of sperm, make sure the sperm get very close to the egg. So this is how that insemination work, right? And a lot of people with unexplained infertility and celiac disease will get pregnant with insemination, which is very simple. Now, if somebody with celiac disease did not have something else like abnormal semi-analysis or blocked tube or something else in addition to the celiac disease, then may not be candidate for insemination. And in that situation, or maybe if somebody tried insemination for 2-3 cycles, it didn't work, then we move on to the next step. And as I mentioned, the next step is IVF. What is IVF? Basically, we're doing the same thing. But instead of just giving you medicine to grow 1 egg, now we're growing a lot of eggs, 10, 20, right? We're growing them all. And then we get them all by a small little procedure through the vaginal under anesthesia. We get them all. And then we send them to the lab where we fertilize them. And we then make embryos. We make embryos. And then obviously we grow those embryos in the lab. And that's how the IVF is happening. IVF is very interesting because we used to do this for infertility, but it's very interesting now. The indication for in vitro fertilization had expanded tremendously. What you're looking at here is an embryo been highly magnified almost 400 times. The embryo is actually inside, and this is the placental tissue around the embryo. So we can actually nowadays biopsy the embryo, right? And when we biopsy the embryo, you can do a lot of things, right? You can diagnose genetic disease and so forth, right? So again, in vitro fertilization is really helpful for people who have problem with the sperm or problem with the tube, or they're not really getting pregnant with insemination, or if they want to diagnose genetic disease in the embryo with the biopsy, they can do that. Recurrent pregnancy loss with abnormal embryos, they can do that. And again, we see a lot of women and couples who wanted to preserve their fertility just because of social indication. We do a ton of that. Of course, there's some other indications as well for celiac disease. So in conclusion, I would say infertility is pretty common, and we're not alone into this, right? And that patients with celiac disease, or or all patient actually, if you're not able to get pregnant within 6 months, I think it's reasonable to see a fertility specialist just to check out things and make sure everything is okay, right? And most of the time, people are successful achieving pregnancy with treatment, right? The thing about celiac disease, though, is a chronic condition, and it is really hard, I think. I'm not in anybody's shoes, but I know it's very hard to find gluten-free diet, but this is what the treatment for celiac disease is. And that will take care of the symptoms, will make sure that the intestinal villi are normal, but guess what? All this problem I mentioned, we know very clearly that all these issues with celiac disease and infertility actually disappear and are cured when patients have well-controlled disease on gluten-free diet. So this is what it is. You just have to do that first. And it's really important that women who are diagnosed with celiac disease and wanted to get pregnant, I think they should work on stabilizing their gluten-free diet situation first and make sure they're very well controlled before they try to conceive, because then otherwise we're getting into all these issues, right? So I think that's extremely helpful. And lastly, I mean, I have a lot of references. So we do have a clinic at UChicago, and I have a lot of colleagues. It takes a village, it takes a team. Infertility work, we have all kind of people working with us, lab technicians, my colleagues, nurses, medical assistant, and we're very, very helpful. We're very happy to actually, consult with anybody, curbside consult, proper if you have a patient or if you have a friend or anybody, we'll be happy to help you anytime. And again, thank you so much for the opportunity to be here and talk to you all about infertility and celiac disease.
Dr. Salih, this was very informational. Thank you so much. I would welcome Dr. Semred to come back on screen and Dr. Verma, and I know that Lori Wellstead is also here, and we're going to take questions. I encourage you, please put questions in the Q&A, and we will address some of our pre-submitted questions as well. I wanted to start because one of the studies, Dr. Salih, you mentioned in your presentation that just came out in 2023, someone had asked, did the studies look at those with celiac who were following the gluten-free diet properly, or just people who have celiac disease? I don't know if that was mentioned in the abstract.
That's actually a great question, right? So the study just looked at people with celiac disease and those with normal, no celiac disease. I don't think they went into to see whether people are better controlled or not. But I would tell you that I think not everybody with celiac disease is so careful like every day. I think if you're trying to get pregnant and you're watching out, maybe you can do that. But I think a lot of patients may not be very well controlled in these studies. But they did not and I think this is really a great study to do, to parse out those who have actually celiac disease and they're not on treatment compared to those with celiac disease and they're well controlled. And I tell you another guess coming out from this really very interesting point. Even like there was a study in UK which showed that there is no difference. It's only one study there, but everything else showed that there is a difference, right? Showed that there is no difference between celiac and no celiac and infertility except for a small little group of women. And the other thing to mention, that could be due because of a lot of people with celiac may be undiagnosed. So they will go to the normal group, not really the celiac group. So there's a lot of confounders to these studies, right? Whether it's controlled or not controlled, whether it's diagnosed or not diagnosed, right? But I think there are some studies also show that with celiac disease, even if people don't have the GI problem, but they have the gluten sensitivity, they will also have problems with infertility and reproductive health. But that was a great observation. Thank you so much for putting that question out, Rachel.
Yes, no, that's great. And I want to look to some of our pre-submitted questions while our participants are warming up. Someone submitted that they had severe endometriosis in their 20s, 10 years before they were diagnosed with celiac disease. And it was also my first of 4 autoimmune diseases that this person now has. Is there a correlation between the endometriosis that came first and then the celiac disease 10 years later?
And again, if I had given this lecture 2 years ago, I would say no. But now after this huge study that came out, the natural study with millions of people, the answer is yes, because they did show that people with patients with celiac disease have there's twofold increased risk of endometriosis with celiac disease. Now, you don't know which one comes to one. But again, I mean, these are all autoimmune disease, and they tend to come in clusters, right? They tend together, right? So patients with celiac disease have 1 to 19% increased risk of type 1 diabetes, 5% increased risk of autoimmune thyroid disease, 3% increase of liver cirrhosis. And then there is pernicious anemia. So I think definitely autoimmune disease tend to cluster together. So the answer is definitely probably yes. They're all related together.
And Dr. Semred, I don't know if you want to add anything to that. Just
am I on?
you're on.
Oh, am I on? Okay.
Yeah.
Yeah, I don't know. These studies are very hard because once you get into a very large study, they're looking at big databases that you don't have all the details of the disease and what phase the disease was, as Dr. Salih said. So it's the good and the bad. You get a big population and you get a possible association, but it's hard to do the cause and effect when you don't know and which celiac patient is when they're active, is it carry throughout their life? I don't think we know this. And in that, I just asked Dr. Salih in response to that about men, I'm curious, does anyone look to see if in controlled men that these sperm morphologies go back to normal? Because there we could look at that
Actually, I
quite
didn't. No,
specifically, but no
I
one's
didn't
done.
see that. Yeah, I
Yeah.
didn't see that. I saw the study showed that the hormone resistant, the testosterone resistant actually go back to normal with a gluten-free diet, but I did not really see anything about this. I mean, the studies in celiac disease in general are scarce, and in men is even more scarce. I mean, there's hardly
Yes.
anything out
Yeah,
there.
they're either very small or they're,
Yes.
but I
Yeah.
have one more important question for you, Dr. Salih, because this comes up in my clinic frequently. And that is women who decide to harvest eggs for fertility and active celiac disease. Is there anything on success or health of that in an active inflamed celiac patient versus someone who is on a strict gluten-free diet and control? Do we know anything about that?
So I tell you right there is no study like that because egg freezing is actually all totally new and very recent. But I can kind of guess what's gonna be on because I see a lot of patients with autoimmune disease and they become really sick during the stimulation part of that. Patients like generally speaking, when you hyperestimate anybody, there is a risk of ovarian hyperstimulation, there is constipation, there is bloating, there is all this nausea, there is vomiting. I mean, there's a lot of things that I'm not saying scaring people from egg freezing, but once you get a lot of eggs, like you get one and you get the pre-menstrual syndrome, and with your menses, you get some symptoms. You get 20 eggs, 30 eggs, 40 eggs, you get a lot of symptoms, like GI symptoms.
Yeah.
And I think if somebody is already like on the edge, I think the symptoms will get worse. But more importantly, I would say it would be very interesting to look at the number of eggs that we grow in these patients as well. Because, cycles are variable, but you can look at 20 eggs and you try to grow them, especially, for example, patients who smoke. You look at them and they just don't grow, right? So it will be very interesting to see if these women will get the potential, the maximum number of eggs. I would probably imagine they're probably not going to get as a good outcome as other women, for sure.
So maybe it would be good to have quiet disease if you're going to plan to harvest eggs, to the same principle, to be well controlled and in a good health yourself before you proceed forward in that setting as well.
Absolutely. Absolutely. Yes. Absolutely.
So, Dr. Sumred, this is actually a follow-up question to that specifically. This was in pre-submitted questions. How long would you say, and Dr. Salih, you can answer this too, how long should you be on a well-controlled gluten-free diet before trying to conceive? Like, is there a good rule of thumb?
Yeah, so I can answer that partially. I think what I use is the same sort of when Dr. Salih showed the slide on the tissue transglutaminase antibody, perhaps interfering with the whole process of implantation. I would say you definitely should wait until your tissue transglutaminase antibody is negative to imply that those aren't circulating around. And with regard to getting better, the bowel regenerates very quickly in 5 to 7 days, but you have to be strict gluten-free. So it's always who can get really strict enough gluten-free quickly to make a quick histologic damping inflammation kind of recovery where you're going to be absorbing all your nutrients and be in good health yourself. Your body's in good enough health to take on a pregnancy and support it. So, there's no hard and true answer because some women are getting to that age where they want to get going, and to say, well, let's wait a year or two till we rebiopsy you. I don't know. I don't think that that's necessarily, we don't have any evidence for any of that. So I go by the tissue transglutaminase antibody. I want that to be negative. I want their symptoms to be better. I want to be able to see that if they had an anemia or any other consequences, that everything is going towards the positive to imply that the bowel is healed. I don't know, Dr. Salih, what
Yeah,
you would.
absolutely. I mean, obviously, I just wanted to say the way our system works, we really collaborate a lot with the primary care physician and gastroenterologist. So when I see patients with celiac disease or even things with irritable bowel syndrome and Crohn's disease, I always wanted to get a medical clearance from the gastroenterologist. So I'll be sending my patient back to the gastroenterology to make sure that they tell me it's okay to go, right? Because obviously they know this better. But this is a very important point that Dr. Samrat mentioned about age. We get in this situation where patients are not in their ideal health, but they're in their 40s, and we have a very narrow window. And of course, and it's more so with obesity. People need to lose weight, very high BMIs, and would like for them to, to lose some weight, like people BMI 45 or so. I mean, it's really huge, right? So, but sometimes you just have to kind of, cost benefit and a lot of time we have to do things for those patients, although in a not ideal situation just because of the age. Age is very interesting because women 35 and younger, they tend to have a very good fertility. But then after 35, there's like a 5% decrease every year in the fertility rates, right? And when it gets to 40, it even get worse. And I think we know for sure that the decrease in fertility in relation to age is mainly due to the quality of the eggs. Not so much the lining, not so much the sperm, not so much the tube. It's the quality of the eggs that really deteriorates after age 35. And this is why a lot of young women nowadays are coming to us to cryopreserve their eggs, which I think is fantastic. There was a time in my life when I've seen a lot of women in their, kind of early 40s, and they really struggle, and I struggle with them. But now this has been mostly replaced by younger women trying to be proactive, which is really wonderful. But thanks for bringing that age situation in the discussion.
So can I take you to pediatrics then? So I'm a pediatric gastroenterologist. So would you say it's a safe statement to make with whatever data we have or we don't have, that if there is a child who has celiac disease and they are very adherent to their gluten-free diet, then from a celiac standpoint, as they get older, then the fertility should not be blamed, or infertility or any of those issues should not be blamed on celiac disease? Is that I know we don't have all that data, but would you guess that then if somebody is having some reproductive issues, but they've been on a gluten-free diet now for 10 years, and TTG and endoscopy and everything else is normal, then are they at the same risk as the general population?
I will say absolutely, absolutely. But I think the issue with celiac disease, like you're taking that gluten diet and stuff, and you're creating those antibodies. I mean, there are people like thyroid disease patients who have the antibody, whether they eat or don't eat, right? So you can't really control those thyroid antibody when we see them. But I think celiac disease is so unique that you can actually dampen and you can actually quiet and you can suppress those antibodies, which is causing the problem. So I would say absolutely, I think there is the success rate and the well-being of those patients from a reproductive health point will probably be more than a normal population, I would say.
Yeah, I
Not to
think
mention they're not going to get anything like endometriosis policy, because even normal population get these things, right? But it's just not going to be that heightened rate of incidence.
and I think the Ludwigson study from Sweden showed in their original, there's some data that's gone beyond that, but that the infertility rates, at least at that study, tended to be present compared to control women while 2 years after diagnosis. And then after that, the fertility rate came back as they were on the gluten-free. Once they're beyond 2 years and on that gluten-free diet, the fertility rates came back up in women. So I think there's some data to suggest that if you're quiet, you might be close to the same population. And not all women who have celiac are infertile too. That's, certainly I see many, many women who have had children and got diagnosed after having their children without any problem. So we clearly know that it's not, we don't know why some are affected and infertile and others aren't. There's a lot of unknowns here.
I guess it goes back to, we don't know why some people have abdominal pain and some have diarrhea.
Yes,
and some have
exactly.
So it's that multi-systems
Right.
kind of thing. But,
Yeah.
I guess from at least some reassurance for parents who might be on this call as well with this in terms of if their children have celiac disease. That's another reason that they should be, besides many other reasons, to stay on a adherence on a gluten diet.
I personally have a question, and this is, Dr. Salih, if someone comes to you, let's say they do not have celiac, but as you are running tests, would it ever benefit to add a blood panel to, if someone is having infertility issues? All I'm saying is, could this be an opportunity to perhaps uncover someone's celiac disease if they are undiagnosed and having fertility issues? I don't know if this is crazy. I was just thinking, as you're I saw your tests and everything you do, and you're looking at, the ovaries and everything. And I'm just wondering, for blood work purposes, would it ever benefit to look at someone's TTG?
Absolutely. I think some studies showed clearly that unexplained infertility is associated with celiac disease. There is higher incidence of celiac disease in patients with unexplained. So if you don't find a reason for it, then I think, especially if somebody have minor symptoms, you can go for it. I mean, there was a time where, I don't think unexplained infertility, like 30% of people have unexplained. So we're not really doing that testing for celiac disease for everybody with unexplained. But certainly, if there is any family history, any suggestion from the history, I mean, celiac disease can present with a lot of things like short stature, anemia. I mean, of course, Dr., my colleague can comment about that. So if there's any suspicion, I think it's really worth doing for sure, 100%. And there are studies which looked at that as well. I do see some questions in the Q&A. I don't know.
I just popped it up on my screen. I agree. So the first, I actually think Dr. Verma. Okay.
To Dr. Salih is, why don't you just do a celiac panel and everyone?
You know what? I would love to.
Hormone tests. You're doing all of those hormonal tests.
I'm going to ask you a question. If I'm to pick one little test that the insurance is not going to frown on me.
And they won't frown on a TTG.
Okay, good.
TTG, IgA, and an IgA level.
Yes, that's all you need. That's all you need.
I think I'm sold into this tonight, okay?
Yeah.
There you go.
I'll let you know how it goes, right? For sure.
Dr. Verma, this question is for you. When a patient with celiac disease has a baby, when should the baby be tested to see if they have celiac disease, since it is a genetic disease? And do they do those tests right away after the baby is born?
So no, the child has to be eating some gluten. So usually the recommendation is, if they are not symptomatic, to do the first test at 3 years, so long as you're eating gluten. That becomes an important thing. So if you do it at birth, the baby's not eating gluten. And if you're symptomatic, of course, there are some children diagnosed at 1.5 years of age. So that's a different reason to do earlier screening. But if it's a family history, then after 3.
Okay.
And you do the antibodies. We're not talking the genetic test. We're talking about the antibodies.
That's great. Thank you. Dr. Salih, I think I'm going to let you, and then Dr. Semrad, you can tag in. If your celiac disease goes dormant, I think meaning you have full healing and your levels are normal, can your PCOS go dormant then? Or once you have PCOS, that could be caused by celiac disease, do you have that also for life?
That's a great question. Amazing questions. I wish if we have all the answer for that. So polycystic ovary syndrome is a situation where women will have things like irregular period. They may have like abnormal hair growth or acne. And if you look with ultrasound, you see this polycystic ovaries, a small little cyst or follicle. So, I mean, there are a lot of factors for polycystic ovary syndrome, including genetics for sure. We know that for sure, even men who have women in their family with history of polycystic ovary syndrome, they do get some issues as well, right? So I think the point is the polycystic ovary syndrome totally caused by celiac disease in that particular person? And if that is the case, I would say the polycystic ovary syndrome would improve a lot, right? If it's totally caused by celiac disease. Now, a lot of time, like I said, polycystic ovary syndrome also have some genetic predisposition and some other factors, so it may not go away 100%. However, polycystic ovary syndrome have a lot of symptoms, and certainly the symptoms can go so much better, right? So severe acne can improve, Hirsutism, which is very hard to treat, may improve. Even patients with irregular period or no period, a lot of time, even if they just lose weight, they start ovulating. If they take some supplement, they start having regular periods. So I don't think polycystic ovary syndrome goes away, but most of the symptoms can actually get really much better and improve as well. But that's a great question as well.
Yeah, these are good questions. Dr. Semrad, I don't know if you have anything to add to that.
Oh,
No.
no, I don't know any
You're
more
like-
than Dr. Salih.
Yeah.
And I really
I-
wanted to circle back to what Dr. Berman mentioned, or I mean, Samarad, like, can we just, or some of my, the questions, just testing patients with unexplained infertility for celiac disease. If that test is very simple, I think we really ought to do it. And I say that because if somebody has something simple like just avoid gluten diet and then things are going to get better and you get pregnant, I mean, that's so much better as opposed to getting into all this ovulation induction and in vitro fertilization and, thousands of dollars. I mean, that may be just a simple fix to the problem, to be honest.
Yeah, and then when you have that positive TTG, you send them to Dr. Semrad before they start the gluten-free diet. They should not start the gluten-free diet.
Yes, before.
Yes. So this kind of goes back to one of our first questions, but this was pre-submitted. And so Dr. Salih, have you seen a difference in outcomes? And what they're speaking to specifically is miscarriages, infertility after trying more than a year, and with success with fertility technologies between patients on the gluten-free diet versus not, between asymptomatic and symptomatic. I think we've covered that you need to be adherent to the gluten-free diet and fully healed. But have you personally, like in your practice, seen where there's an improvement in people's fertility once they are more adherent to their gluten-free diet?
Yeah, absolutely. I mean, I can recall a few patients, where usually younger patients in their like late 20s, early 30s, where they're going to take like few months off and then come back. And, we had tried like insemination for a few cycles. It didn't work. And then they decided to go ahead and just take a break and get better and adhere to their gluten-free diet. And they come back and we do 1 or 2 cycles and they're getting pregnant. So certainly we see this a lot, to be honest to you. Unexplained infertility is one of the very kind of hard things to do. And if you don't know the reason, sometimes nothing works. So if you can fix something, then I think that's really helpful. Absolutely, I think that's the case.
And how prevalent I know you covered some of this in your presentation, but specific to male infertility, are there ways to, one, how prevalent is it that we see? And number 2, are there ways to increase fertility for males that may be related to celiac?
So the studies I looked at, it says about so we know that about 10% of men can have infertility in general, right? And then about 1% of men with infertility, they have celiac disease, right? So again, we just mentioned that I don't recall a study looking at semen analysis parameters, but we know that the hormone and the insulin and the testosterone resistance had actually improved with adherence to gluten-free diet, right?
Great.
So I think that's really,
Yeah. I some of the pre-submitted questions, I think some people have really struggled with infertility and endometriosis, and then maybe got diagnosed later in life. And I think there's some questions of what could they have done differently? They're still they had 10 years where they were trying for pregnancies and struggled quite a bit. And within that time also got diagnosed with celiac. And I don't know if, I think they were just saying, was there anything else I could have done? I think you look inward, and that makes me sad, this question, but I do know it is a very real thing for people. And
it's very real thing. I mean, endometriosis is common. It's about 7% of women have endometriosis, and endometriosis truly causes a lot of pain symptoms: pelvic pain, pain with the period, pain with sex, in addition to causing infertility. And there is a lot of stages of endometriosis, but even if it's very, very minimum, it still can decrease infertility, right? So I think, in all honesty, diagnosing celiac disease earlier and controlling the symptom earlier would have been very helpful for other women, right? But having said so, things like the same thing like polycystic ovary syndrome or endometriosis, they may not go away 100%, but it makes the treatment easier. Like I
Mhm.
see two women with endometriosis, everything is the same. Somebody, you just do very little treatment, they get pregnant. And some other person, they go all the way and they still struggle, right? So there's a lot of other factors that we really don't know. But I think taking care of Crohn's disease will probably, and celiac disease will, and all these things will probably help a lot. And then you have to work with an infertility specialist. I think that's another problem I see. Because a lot of the endometriosis women go to the gynecologist, and the gynecologists are really very good in dealing with pelvic pain, but not so much in dealing with infertility, because that field has become so specialized that it's really hard for anybody who's a general gynecologist to kind of get to know all these things. And I think making use of technology and even just proceeding forward for IVF, because that will solve a lot of problem. Like, so endometriosis, there is decreased implantation, there is decreased fertilization, there is impaired tubal motility. There is a lot of many subtle things that can cause infertility. So when you do IVF, for example, you can solve a lot of these problems as opposed to struggling with it. So I think finding a good REI doctor, infertility doctor, who can take good care of you. Now, endometriosis sometimes cause diminished ovarian reserve and low egg count. And I think in this situation, it may be hard. You may need something like an egg donor or something, right? So if somebody have endometrioma and cysts in the ovary. So it's a very complex disease. And we know for sure it's an autoimmune disease. So these autoimmune diseases go all together, right? So I think controlling celiac disease is really very important. But endometriosis in itself need a lot of special care as well. Absolutely so.
Rachel, I don't want people to feel bad who are writing in. The truth is, an association is not cause and effect. Most of what we know about autoimmunity and celiac disease is associations. There is very little data, if there's really no data actually, to say celiac diseases causes any autoimmune. They're associated together. We don't know if that's genetically associated on the same gene that gets carried and inherited together, or whether one causes the other. So we just have to be very careful on any of these discussions about autoimmunity to sort of say, oh, if you had your celiac disease diagnosed and cured, you'd be a completely different person.
Right.
None of this would have happened. So we just have to be very careful not to imply and make people think, oh, if I would have been diagnosed early, all this would have been different. We don't know that. We do not have that degree of knowledge yet about celiac disease and autoimmunity to really make those, hardcore cause and effect. And so that's just a very important thing that we keep in mind whenever we talk about it. Yes, there's associations, but we don't know cause and effect.
Right. I really appreciate that comment, Dr. Summer, because I agree. We don't want to cause hysteria.
Or just people thinking they could have, if someone picked it up earlier, their whole life would be different. You don't know that.
Yeah.
It may have helped. It may, as Dr. Salih said, it may be that you still had the same issue, but maybe one aspect of it was not as bad, one associated aspect, but we don't know. So,
and Dr.
we're
Salih,
trying to find out. We're not satisfied not knowing, but we need more information.
We do, for sure.
Absolutely. I want to shift, someone had a question specifically about lack of periods. Is there an association with that, with celiac disease specifically?
So again, just like Dr. Samara says, it's not it's not causation, right? But we know for sure that malnutrition, and when somebody's underweight, or if somebody's not eating, even if the weight is normal, but they're not eating right, they can get irregular periods. It affects the hypothalamus. So it's kind of affect the hypothalamus and cause irregular period, right? So if somebody's underweight, not eating right, that can cause lack of period or irregular period for sure. So that can be one of the mechanisms why celiac disease can cause that through the nutrition. But also the autoimmune disease, and one of the papers I read, it says autoimmune disease it comes into cluster, just like we said, right? So there could be autoimmune disease affecting the pituitary gland and other part of the body that can affect the hormone as well.
Mhm. It's great. Well, this talk was
Just to
amazing.
say, sorry, Rachel.
Yes.
There's
Yeah,
many,
go
many
ahead.
causes for amenorrhea as well, for irregular period. And again, just seeing the doctor and make sure you go through the things. Like amenorrhea can be coming from hormone from your brain, can be coming from the pituitary gland, making prolactin, can be coming from the ovary having too many eggs, like polycystic ovary syndrome, or the ovary having too few eggs, like ovarian failure, can be coming because there is a problem in the uterus that's not shedding. So there's just a lot of levels for amenorrhea, right? So it's very important that you get a diagnosis. And I mean, obviously, when we say about hypothalamic amenorrhea and malnutrition, this is the diagnosis of exclusion when you rule out all other things like structural and hormonal and endocrine that can cause amenorrhea, because there are some serious things that can cause amenorrhea, right? And then even including like pituitary tumors, like brain tumors can cause amenorrhea, right? So you have to rule out all these things. And then you can imply that maybe malnutrition can cause amenorrhea as well.
This was amazing, Dr. Salih. Thank you. I don't know, Dr. Semrad or Dr. Verma, if you have any closing thoughts, but this I thought was really a great discussion. But Dr. Semrad, do you have anything in closing?
No, I think we covered as much as we could, as much as we know.
Yeah, it was great. Dr. Verma, I want to look to you.
Oh, I think it was amazing. I just think we need to keep in mind that if you have one condition, it's possible you could have another autoimmune disease. So whatever you have, you just treat it well. So whether it's celiac disease or it's Crohn's disease or any other disease, you've got to bring that under control and hope that everything else falls in place. And you just kind of keep it in mind. I totally agree that we don't want to have more anxiety. But I think what we do want to know is that whatever condition we have, we treat it to our best. But thank you
Absolutely.
so much, Dr. Salih. This
Diagnose
was
and treat.
fantastic.
We need diagnosis and treatment as soon as we can, and that's
Yes.
important.
Yes, absolutely. And what's wonderful is obviously working with your care team, including your primary care physician, your OB, and then turning to your gastroenterologist if you're living with celiac, and then bringing in sometimes people like Dr. Salih if there are things that it's not happening, but you have an amazing team, and we are so lucky to be surrounded by such wonderful practitioners. So thank you, everyone, for tonight. I think it was a really great discussion, really informative, and we will definitely be sending out this video. So thank you, everyone.
Thank you.
Thank you.
Bye.
Bye.
Thank you.